Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. Our lips are best known for kissing, especially on a day like today, and they help you eat and talk. They come in all shapes and sizes, and the most notable ones, like Marilyn Monroe and Angelina Jolie, are often desired by many women. Most women don't ever consider the importance, though, of having healthy lips. With today being Valentine's Day, we're going to get some great advice from Express Care's Dr. Jitka Lom, who joins us in studio now to tell us more about lip health and those nasty fever blisters and cold sores that can keep you from puckering up. Thanks, Doc, so much for coming in. Happy Valentine's Day to you. So why are healthy lips so important?
Well, as you mentioned, our lips are a portal to our mouth, to our teeth, and to our insides. And so sometimes they reflect what's happening on the inside as well. But in general, we want to keep them healthy so that we don't have bacteria close to our mouths where we can swallow them and become sick. And we also don't want to get sores and ulcers that can get infected.
Now, are dry lips a sign of a major health problem or any sort of health problem?
They can be. Most often they're a sign of dehydration. So our lips lose their water about 10% or 10 times as fast as the rest of our body. So you can easily get dry lips and cracked lips from just not drinking enough water. And it's a good sign to yourself, if you're getting dry lips very often, to remember to drink more water.
Now, does someone's diet affect the condition of their lips?
It can. Certainly a vitamin C deficiency in an extreme, like a scurvy. Back in the old days, people would have cracked and bleeding lips, or if you look at malnourished people, they'll have very bad lips, or people with cancer and so on. So you can see that lip health has a lot to do with their internal health. But most often, if you maintain a healthy diet, your lips will be healthy. Just remember to drink more.
Okay, now I know some people that use chapstick all the time. Is that good for your lips?
There's something called chapstick addiction. There's actually about 100 different kinds of chapsticks. Lip balm is very healthy, especially something like petrolatum, like something like Vaseline is very healthy. Chapsticks that have a lot of menthol or camphor or eucalyptus can actually be irritating to your lips and drying. So you put it on and it seems like your lips are even drier, so keep putting it on. So that's how the addiction kind of happens. So if you choose a chapstick or a lip balm that is very mild and doesn't have a whole lot of colors or additive or strawberry flavor, I think you're better off.
Okay, good to know, definitely. Now, what are cold sores?
Okay, so cold sores are viral infections. They're little blisters on your lip that are caused by the herpes simplex virus. Herpes is kind of a nasty word, but it just means blistering infection. And this is a virus that you can pick up from other people, and it will cause a sore on your lips, and it can be quite painful. Things that trigger it are the sun or stress or just being sort of low on your immune system in general.
Now, are cold sores the same as, I've heard of canker sores as well as fever blisters? Are they the same thing?
That's a great question. No, canker sores are different. They tend to be more on the inside of the lips, and they're more like an ulcer. They just look like a sore, like a yellowish kind of or reddish kind of depression sore, and they're very, very painful. They can last for weeks. And the cause of them is really not known. They're not caused by a virus. They're just they just appear, and painkiller is really the only thing you can do for them. And as far as fever blisters, those can be the herpes simplex viral infection I was telling you about, or just basically from a fever, the lips will get dehydrated and very dry, and then you'll get a sore on the lip just from the dryness.
So what's the best way to treat a fever blister or a cold sore?
Okay, so cold sores, you can buy over-the-counter medication. There's Abreva and others. They're quite expensive. Mostly just moisturizing with some Vaseline would be very helpful. And then there are actually tablets that you can get, or prescription medicine of antiviral medication like acyclovir, and they're super effective. So if you just feel the tingling or the little discomfort that comes before the blister, people know that one's coming on, you can take that medicine and actually prevent it from happening.
Is there a time that you say, okay, maybe this isn't working, I need to go see a doctor?
Yeah, certainly. If you have a non-healing sore, if it's been more than a couple of weeks with a sore on your lip, you definitely need to be seen, because you can get cancers of the lip, both from the sun, a lot of sun exposure. We call that farmer's lip, where farmers have been out in the sun or fishermen too, and get a lot of sun exposure and get a non-healing sore. Other sores on your lips could be an infection that needs treatment.
Okay, now is there anything to prevent a reoccurrence of it?
Yes, moisturizing your lips is very important, avoiding a lot of sun exposure. One of the things you can do is buy lip balm or chapstick that has SPF in it. You should have SPF 30 or higher and apply that frequently to your lips. And then if you're one that keeps getting herpes simplex or like cold sores over and over and over, you can actually take medicine every day to prevent it. Medicine's very, very safe and very cheap and easy to take one a day to prevent it.
Now, are they contagious?
They are contagious, yep. So no kissing when you have a cold sore.
All right, good to know. Well, we are going to talk more about this after the break. Dr. Lom is going to take our viewer questions when Healthy Living returns. Stay with us.